Coming to infections of the hand, very common area. Most common infection of the hand is the nail bed infection called as paronychia. And when it involves the pulse space of fingers, it's called as the phelon or the whitlow. When you look at the questions that they ask you, phelon or whitlow usually involves the thumb, followed by the index finger. And because it involves the pulse space, you give a vertical incision to treat it. You will never give a horizontal or a fish mouth incision. Not given. Complications are, if you don't treat it well, osteomyelitis more than tenosynovitis. Paronychia, most common infection of hand. Organism, whether it's phelon or paronychia, is Staph aureus. But sometimes you have to remove a part of a nail to drain the pus. So a wedge has to be removed. The third infection of hand, not as common as the first two, infection of the flexor tendon sheath of finger, causing uniform swelling of the finger, flexion of the finger, percussion tenderness, pain on stretch. So 4 points: uniform swelling, flexion of the finger, if you stretch it, it's painful, percussion tenderness. If you have to choose one, percussion tenderness is the most specific sign. These are called as Cannavale signs. Cannavale describe these signs. So Cannavale signs. Coming on to the very important surgical anatomy of hand, you have a thenar space. The thenar space has got the index finger tendon and the first lumbricals. Then you have the mid palmar space where you have the other three finger tendons and the other three lumbricals. Somehow the examiners, they love the lumbricals. You have a radial bursa over the thumb area and the ulnar bursa that also drains the little finger. The two bursa communicates in the forearm at a space called as forearm space of Perona. This forearm space of Perona will involve the infection of the little finger in the forearm transfer to the thumb. So infection of the little finger can go to the thumb but can never involve the index finger. Remember this, very commonly asked. Dear friends, we must also remember how the lumbricals work. Lumbricals, look here. This is what Kapil Sharma taught us. Boom. This is a sign he has used in his comedy. He is making a L in his hand. L for lumbricals. Metacarpophalangeal joint flexion and interphalangeal joint extension. This is the function of lumbricals. The first two, the lateral two lumbricals, are supplied by the median nerve, the other two by the ulnar nerve. When there is a median or ulnar nerve palsy, these lumbricals are paralyzed, causing opposite of the action, hyperextension of MCP and flexion of interphalangeal joints. When you treat this is called as claw hand. When you treat this, you try to replicate the action of lumbricals. You bend the knuckles. The metacarpophalangeal joint are called as knuckles, called as knuckle bender splint. When you look at infections, chronic infections of the foot, you will see multiple discharging sinuses here. When you do an MRI of them, you will see dot in the circle sign. Mycetoma on MRI has a dot in the circle sign. Mycetoma occurs in different areas of the world which are used to barefoot walking. It's a chronic infection of subcutaneous tissue. Will have multiple discharging sinuses, swelling, but is in contrast painless. So swelling, sinuses and granules come out of it, but painless. It can involve everything except the nerves and tendons, but even then it's painless. Occurs due to barefoot walking. Two types. Actinomycetoma, which is rapid, the bacterial cause. Eumycetoma, slow grumbling infection, fungal cause. So it's a granulomatous infection of subcutaneous tissue. What is AMMF? People think it's actinomycetoma, Madura foot. No. A means actinomycetoma involves the mandible, angle of jaw. Multiple discharging sinuses here. You will think about actinomycetoma. Mycetoma, fungal infection, involves the foot. That's how it goes. Now, any chronic infection can have a sundry appearance or a Codman's triangle. So is our mycetoma. It can also have lytic cavities. Two conditions in orthopedics which you should remember by heart, which are painless, mycetoma and Charcot's.